Welcome, everyone. We are so delighted to have you join us today for ADAA's live Q&A, How to Free Yourself from the Fear of Vomit and Reclaim Your Life. My name is Jolie Busby, and I'm the Education and Training Manager here at ADAA. So a little housekeeping for today's session. This webinar is being recorded. Closed captioning and translation are available. All attendees at today's session will receive a link to the recording within 48 hours. This webinar is Q&A enabled, so we ask that you place all of your questions in the Q&A feature, and our presenters will take each question in order. So thank you for doing that. Now I am pleased to introduce today's presenters. Ken Goodman treats anxiety and OCD in Los Angeles. He is the author of the Anxiety Solution Series, Your Guide to Overcoming Panic, Worry, Compulsions, and Fear, a step-by-step audio course, and Break Free from Anxiety, a coloring self-help book. In addition to writing the Emetophobia manual, he produced the Emetophobia Manual Workshop, a 10-week workshop in which viewers with 8 others with emetophobia sufferers on their healing journey. Next, we have Dr. Ashley Smith. She's a licensed psychologist, author, speaker, and co-founder of Peak Mind, the Center for Psychological Strength. She is passionate about using cognitive behavioral therapy, positive psychology practices, and applied neuroscience to help people struggling with anxiety live better lives. And we also have Hannah with us today. Hannah is a 21-year-old college student in the UK who has suffered from emetophobia for most of her life. Last year, she realized how much it was impacting her life and decided to put all of her effort into recovery. And she's been working with Ken for about 6 months and is here today to share her story and experiences. So again, welcome to our expert panelists today. Now I'm going to pass the presentation over to Dr. Smith.
Thank you. Welcome, everybody. So I know we've got a lot of folks here, which is super exciting. I'm counting at almost 60, and then I know we're going to have more people trickling in, which is fantastic. So as Jolie said, please be sure and throw your questions into the Q&A, not the chat, and then I'll be monitoring that and asking Ken and Hannah your questions. I've got a list of other ones that we got beforehand as well. So as you guys are putting all of your questions into the Q&A, I would love to kick it off. Same question to both of you guys. So Ken, I'm going to put you in the hot seat first. What is one thing that you wish everybody knew about emetophobia?
Boy, there's so much, but I think the main thing is that people need to understand that this is a phobia. This is a disorder that can be overcome, that you can learn to overcome this phobia. You can beat emetophobia. It just takes patience and persistence. And you need to have the right type of materials, tools, and strategies to get you there. But it can be overcome.
I think that's a fantastic message, right? Hope. So, and then I'm sure we'll dive into, as we get going today, some of those, what are the right techniques and how to do this, right? Hannah, what about you with your journey? What is one thing that you wish everybody knew about emetophobia?
Unfortunately, Ken stole what I was going to say.
I thought he might.
Unfortunately, I think it is the most important thing, though. Like, I was definitely one of those people who was like, well, this is just my life now. There's no way that I'm going to get over this. I couldn't see myself getting better. You hear stories online of people getting better, but I definitely was of the opinion of, well, they weren't as bad as me, or I've had it for longer than them, or it's ingrained in me too much. And I think we all kind of discussed at the start of the workshop that, yes, we were excited, but we all did feel a little hopeless and curious whether it was going to work or not. And I'm happy to say it does. So yeah, very similar to Ken, it is possible to overcome. And yeah, it's difficult to believe, but it's definitely possible.
Yeah, you know, all 8 people in the workshop were all pessimistic. No one felt particularly hopeful.
Mm-hmm.
Yeah.
Yeah. Well, and I think that's great, right? This is a treatable condition, even if it's been very long-term, entrenched in severe. I know I've certainly seen emetophobia to the point where people are unable to eat or really function. So it can get really significant. It's not just a little quirk. But
yeah, why would you think that you can get better if you've been suffering your entire life and you've been to treatment and you've never gotten better? There's no reason to feel hopeful.
Exactly. Now we've got a question coming through about exposure therapy. So does recovery include exposure, and what does that look like? And I'm sure you guys both have tons to say on that.
Yeah, exposure therapy is critical to getting better. I usually don't start with exposures right away. I think people need to get a really clear foundation about why anxiety has them trapped and the strategies they need. They need the tools. And then once they have all that, then we can start doing exposures. And it's done incrementally, starting with smaller challenges and then working their way up. But it can be scary, but you're the one in charge, patient's the one in charge. And so they need to be working in collaboration with the therapist and just starting off with the smallest of exposures.
And Hannah, I would love to hear from your perspective. How would you explain exposures to people? Because sometimes that word itself is really scary and people get intimidated by it. So, and if you don't feel comfortable answering, I'll put Kim back in the hot seat.
That's okay. Yeah, so I was definitely worried about doing exposures before we started it. I think the first thing, particularly emetophobia, people think when we say exposure therapy is, oh my God, I'm gonna have to, like, they're gonna make me make myself sick, or I'm gonna have to go out, I don't know, licking doorknobs and things, but it's not like that. It's not like that at all. I think something we discussed in the workshop quite a lot was making sure we're doing exposures effectively, and the difference between planned and unplanned exposures. You have to be able to do the planned exposures to deal with the unplanned exposures. Another thing,
let me interrupt Hannah for
them
1 second. So,
That's okay.
just so people understand, an unplanned exposure is something like, let's say you're a mom and you hear that someone in your child's class got sick. So all of a sudden you're just thrust into it. Whereas a planned exposure is something you do on purpose. Like, for instance, eating a food that you feel might make you sick. So sorry to interrupt you, but Hannah, continue on.
Yeah, it's definitely something I tried before by myself before starting to work with Ken. However, I definitely didn't understand how to do it effectively, and I would kind of just throw myself into the hardest situations I could think of without very much preparation. And again, another thing we spoke about was the difference between doing an exposure and like white knuckling through it and just about getting through it, and actually doing an exposure, living it and being okay with it. And I think the way that we made kind of exposure ladders and made things on smaller increments was very helpful. It makes it a lot less scary.
I think you guys are both sharing such great information. And just to add just a little bit, when I think about exposure, I think about getting into a cold swimming pool. Like, if you stick your toe in and you pull it out and then it stays cold, right? And you stick it in again and if you pull it out, it stays cold. So exposure is just sticking your toe in and getting used to it. And then what Hannah was talking about, kind of building that ladder, and what Hannah and Ken are both talking about, kind of those small increments, that's like getting into the cold pool a toe at a time and kind of working your way up, like into your knees, then to your hips, kind of getting used to it each step of the way, as opposed to cannonballing into a cold pool that way. And the whole point is to help train your brain so that you don't get those fear responses anymore. Now we've got some great questions coming through. Would you guys mind sharing some really common exposures? You've touched a little bit, right? Like, do you have to make yourself get sick? Let's just clear that question up first. Do you have to make
No. You do not have to make yourself throw up to conquer emetophobia. You do not have to do that. I would not recommend that.
Awesome.
But there are a lot of exposures to do, much more so than I think any other phobia I can think of. The amount of exposures you can do, from exposures having to do with germs, exposures having to do with eating, exposures having to do with panic situations where you feel trapped, exposures having to do with looking at pictures and videos of people throwing up, pretending to throw up. There are so many different kinds of exposures. Hannah, what did you start with? What are some of the ones that you started with?
If I think back, like there were a lot of safety behaviors I used to have, which I had to try and expose myself to and cut out at the start. It would have been something very simple, like um I used to get really worried about giving other people lifts places because I was like, well, I'm stuck there now and I can't just leave because they're relying on me. So I get moving down here, that was probably one of the first things I did was, okay, like I'll go for a short journey and someone else can come in the car with me. And then I'd slowly make the journeys a bit longer with people in the car. And now I don't even think twice about it. And I'll be a passenger in other people's cars as well. So it's probably one of the first things I did.
Mm,
That's
yeah.
awesome. What were some of the exposures, Hannah, if you don't mind me asking, I'm really curious, what were some of the ones that you found really scary at first that you have completely conquered and that you feel really proud of?
So if I think back to about this time last year, if I had to go into a class at uni or anything, I would not eat beforehand. In my head, if there's nothing in my stomach, I can't get sick. So even if my class was at 4 p.m., I wouldn't eat beforehand. I would wait till I got back. And I think it took realizing that that was actually making me feel worse to get over that. I think I would start with, okay, well, I'll have a small snack and I'll have it like an hour before I leave. That way it's got time to kind of digest a bit and then I'll go out. And again, now I like throw my breakfast down my throat as I'm running out the door, running late in the mornings, and like I'll eat whilst I'm out. Like it just doesn't bother me anymore. I know that eating is going to make me feel better, and that's definitely what it took for me to, because it was scary. Like I didn't want to do it. It had been so ingrained in me that if there's nothing in my stomach, I can't be sick, which firstly isn't true. But also it just makes you feel so much worse. So yeah.
And if something is really scary, you can always break it down into something that's more manageable. So I remember having a client who was terrified to drive after she ate because she thought maybe the motion would make her sick. So I said, all right, well, why don't you just eat a sandwich and just drive around your neighborhood? Oh, no, that's too scary. All right, well, why don't you eat half a sandwich and just drive around the block? No, that's too scary. Okay, just have a quarter of a sandwich and drive down the street. Oh, no, that's too scary. All right, why don't you just like lick a carrot and just sit in your car? That's what you talked about. Just like literally touch the food to your mouth and just sit in your car. And you just have to start with wherever you feel is going to be a little risky, but you can do it. And then move on from there.
Yeah, that's great. And I love that point that you can really break exposures down to find a step that you can take. And I want to point out to everybody listening, did you hear Hannah say these things were really scary and now she's doing it? Piece of cake, no fear. That's a really important part when it comes to exposures is you build your courage, you get through it, you get confidence, and life opens up. So we got tons of questions coming in. So Ken, what recommendations do you have when the fear is based around other people getting sick, particularly kids? So I'm thinking like for parents who are afraid of their children getting sick.
Yeah, very good question. And to overcome that, you have to do a lot of exposures to get there. Most people with emetophobia have a fear of other people throwing up as well as themselves. Some people, it's mostly one or the other. But particularly this time of year, fall, winter, when viruses are going around, people become very fearful. And it really requires you to do all the photo and video exposures. You have to get used to the idea of other people throwing up. So you start off with photos that are mild, and they're all in my book, then to videos that are mild, and work your way up to very challenging videos. And again, you can do it incrementally. And when you get to videos, you can turn the sound down all the way. You can reduce the brightness. You can look on your cell phone as opposed to your laptop. So you can incrementally step up the hierarchy to the point where you can watch a vomit video on a gigantic screen with your headphones on, and it won't even bother you. But it takes a while to get there. But then also doing things like, pouring soup into a toilet and just looking at it mindfully and just, noticing, okay, all my physical symptoms, noticing what it looks like, and just do a mindfulness exercise, just looking at the soup in the toilet and just getting used to this idea. And then there's other strategies that I talk about in the book and the workshop in terms of the mindset that you have to have. normally people with who are parents, who are moms, who, obviously you don't want to have your kid throw up. No one wants their kid to have any sort of illness, but you have to look at these things as practice. So when you are actually doing planned exposures, you're practicing. And when you're doing unplanned exposures, you're practicing. So you have to look at it as an opportunity to practice. And that is the mind shift that everyone needs. No one wants to have their kid throw up, but you have to look at it as an opportunity to practice.
Absolutely. Got a quick question. What do you think about the Thrive program? Are either of you familiar? I'm not familiar with that one.
Well, that's originated in England. So Hannah, are you familiar with it?
Yeah, I've heard of it. I actually did have the book at one point before starting working with Ken, and there are some podcasts out there as well. The thing is, it's a very different method to what Ken works with. It actually almost opposes the idea of exposure therapy, and I didn't get along with it personally. It is just very, very different. It was a long time now as well that I kind of worked through it. I guess there's stuff out there for everyone, but personally, I found working with Ken more useful.
I appreciate that insight. Like I said, I'm not familiar with it. I do know exposure is the active ingredient for any
Yeah.
fear-based disorder, right? It's really hard to overcome any sort of phobia or anxiety disorder without some sort of exposure. So Hannah, another question for you. So often parents say the wrong things during the panic attacks that come along with this phobia. How can you support someone best during these times?
Yeah, I completely feel that. I mean, I have had this since I was a child, so I've only just moved out from my parents' house as well. So I definitely would used to get frustrated with my parents when they would always just tell me, well, just be sick and you'll be fine. And that is kind of the worst thing that you can hear, because yes, that's the end goal, but when you're haven't started recovering yet and when you're in that state of panic, it's not so helpful. I think the most helpful thing that my parents started saying to me was just let it happen, let the panic happen, sit there and accept it. What's the worst that is going to happen? It's not going to kill you. It's uncomfortable and it's horrible, but it is what it is. My dad would always used to say to me, say, okay, anxiety, do your best. And I would sit there and I was like, okay, hit me as hard as you can, do your best. And it never does. It never gets any worse. If anything, it gets better. I think, yeah, something like that, but also accept that it's okay to not get it right every time. And if your child is getting frustrated at you because of what you're saying, it's not them speaking, really. It's in that state of panic, it's really hard to control your emotions and what you're saying. And I just remember feeling like, I want this to stop. It needs to stop right now. And that's all you can think about. So it's not easy to think about anything else. And they might express frustrations and stuff, but I'm sure it's nothing personal.
Brilliant. And Ken, is there any advice that you like to give to loved ones? Like this is what to say or not to say, how to actually be supportive in those really hard moments?
It is extremely difficult for parents when you see your kid having a panic attack. You want to be empathetic, you can give them a hug, but sometimes people don't want to be hugged. It's a case by case basis, and just having even conversations afterwards, maybe in a couple days later when they're not panicking, how can I be helpful for you and what do you need from me? Because everyone needs different things. Some kids will find any sort of breathing or mindfulness extremely helpful. And so to be able to have them learn those kind of skills and then guide them. So if a child is in therapy or a teenager is in therapy and they're learning skills to deal with panic, sometimes those skills are thrown out the window because you're having a panic attack and you can't even remember what to do. And so sometimes the parent can be helpful in that they can serve as a reminder. Okay, this is what, try to remember to do this, is what you need to do. And sometimes they need more cheerleading, to be more of a cheerleader. But, usually when you're having panic attacks, it's not just one. And so you have the opportunity to discuss in between those what might be helpful and how you can work as a team.
Great. Got a question. I think this is going to be some interesting stuff. So I've been suffering with emetophobia for 5 years now with no specific trigger. It causes me to feel nauseous and dizzy all the time. Is this normal? It makes it hard because I'm so afraid of actually vomiting and feeling so nauseous and dizzy every day. It's just a never-ending cycle. So would love to hear your thoughts on that, Ken.
Yeah, one of the most common characteristics of someone with emetophobia is having physical symptoms. And some of the most common physical symptoms are the GI stuff. And they could be nausea, stomach upset, just any sort of discomfort. It also can be acid reflux. You can feel it in your throat. Sometimes people feel it on their chest. And anytime those happen, you can start to worry that you have the flu or a stomach bug of some sort, or you've had food poisoning and you're going to throw up. And no matter how many times you don't, no matter how many times those symptoms subside and you don't throw up, you're just as fooled the next time. Every person with emetophobia falls into that trap, even well into therapy. They still think they're going to throw up because not only are the feelings, the symptoms intense, but the thoughts are intense. And the two in combination makes it very difficult to realize that you're going to be okay. You're going to be fine, that you're not going to throw up. But then that little anxiety monster in your imagination is like, yeah, but what if this is the time? What if this is the one? Hannah, how do you deal with that? Because I'm sure, do you get physical symptoms anymore?
Not so much anymore, but if I think back to when I did, I remember I would sit on the phone to my friend and say, there is something wrong with me. I feel sick all the time. There has got to be something wrong with me. And there isn't. Like, as soon as I started to work on my anxiety and I feel better now, I very, very rarely get physical sensations. And when I do, it's normally I'm hungry or it's just my food digesting. And I've learned what those feelings feel like. And I think it took for me to find out ways to decrease my overall anxiety, for me to stop getting those physical sensations as often. Because I really did used to feel sick every single day, and I would get the dizziness as well. And it is scary because to you it feels like your worst fear is coming true every day. Um,
So
I think
before the workshop, what kind of physical symptoms were you getting?
yeah, so I would feel nauseous a lot. I would get dizzy, get a lot of headaches, but the one that bothered me the most was the nausea, and it would always be like in my throat. I felt like there was something in my throat all the time, and it used to bother me so, so much.
Was this a daily occurrence?
100%, multiple times a day,
And now?
once a month, if that.
Wow.
And I think that's just normal.
Yeah, what happens is when you reduce your anxiety, when you become less fearful of throwing up, your overall level of anxiety goes down. And of course, you get less physical symptoms.
I think this is such an important piece that you guys are both sharing on, right? Because sometimes the triggers can be external, right? Touching something with germs, being around someone sick. But for a lot of people with this fear, those triggers are actually inside sensations, right? Hannah was alluding to that. Stomachs are very noisy. They growl when you're hungry, they get full, they digest, you get gas, you have to go to the bathroom, and you get anxious and you get nauseous. And this fear takes all of that and makes it all feel like you're going to get sick. So love that you guys are talking about learning to tolerate those physical symptoms. That's such a huge part.
And so much of what people do when they have emetophobia is trying to do a lot of safety behaviors and avoidance behaviors where you're trying to protect yourself from anything that's going to cause anxiety. But when it comes from within, there's nothing you can do about it. But still, when you have emetophobia, you're like, okay, well, I'll just, take medicine. I'll maybe take medicine proactively to prevent nausea. And then you start developing these safety behaviors that are just going to make things worse, including, okay, I'm just not going to eat. Well, it's just going to make things worse. Because if you think, oh, well, every time I eat, I feel nauseous, so I'm just not going to eat, that will just make your emetophobia worse.
Absolutely. So any advice for a parent whose son has a fear of vomiting at school and it's resulting in daily panic attacks and difficulty attending class? I mean,
So,
other than like get effective treatment for him.
yeah, ultimately, the person, that child, your son, definitely needs to work with a therapist who treats anxiety disorders exclusively. So, all therapists treat anxiety. You can go to their website and they will all say they treat anxiety along with depression. But you really want to find a therapist who only treats anxiety and OCD, because those are the therapists that specialize in it and they'll be able to help. If you can find a therapist that they're familiar with emetophobia, even better. But that's what they really need. And then if they're not going to school, the clients that I've worked with who do not go to school, I try to get them, try to work with the school. And so they can, again, slowly assimilate back. So maybe they would start off with one class, or even sit in an office just to be there for a period of time. And then from there, do one class. And then from there, two classes, as best as they can, just to slowly begin to integrate back. And some students can do this fairly quickly within a matter of, a few months. Others will take their sweet time, 6 months, because that's what they can do. They do not want to have a panic attack. And so it's really good to work with a therapist and work with a school that can coordinate those efforts. And then even have a safe place for a child to go if they're feeling like they're about to have a panic attack. They can leave the class, go somewhere, and then come back.
Great. Hannah, question for you from another medical student in the UK. Are planned exposure tasks as helpful as the unplanned exposures that you get anyways when you're in healthcare?
Yes, so I would say planned exposures are more helpful. You've still got that element of control. You can do it in a controlled environment, which means you're not throwing yourself into the deep end. Whereas there are a lot of situations in healthcare where you will just be throwing yourself into the deep end straight away. I think you can use planned exposures to learn how to deal with those feelings of anxiety, and how to manage when unexpected things happen. The more planned exposures you do, the better you're going to deal with unplanned exposures, I would say.
Brilliant. I agree
Very true.
completely. Yeah. Ken, do you ever
By the
use...
way, for Hannah in school, I'm sure working in a hospital, there are regular unplanned exposures that you have to deal with. And that's challenging, just like, but it could be the same thing with a child going to school. For the child going to school and having to possibly throw up in front of their peers, horrible. For Hannah going to a place and someone that can actually throw up in the room where she's working, horrible. Scary.
Yeah, I love the courage, right? Hannah, the fact that you're in medicine with this fear since childhood is pretty incredible. So well done.
Thank you.
Ken, do you ever use the vagus nerve technique or stimulation of the vagus nerve in the treatment of emetophobia?
I don't, but I'm eager to learn.
Well, that's where I'm at too. It's exposure first, mindfulness second. So, any insights into the causes of this phobia?
So not really, but in general, there's a genetic predisposition for people with anxiety. Usually there's someone in the family and you inherit some anxious genes. And then there's some sort of trigger. And for emetophobia, it doesn't have to be anything traumatic. It could just be someone else throws up and you find it disgusting. As a child, most people that I work with have had it since they were children. And most are female. I don't know why. It's possible because maybe the disgust is, this disgust tolerance is different for boys versus girls. Girls might think things are more disgusting. So therefore they're grossed out, they feel anxious, and they don't want it to happen again. And so they start doing safety behaviors, they start avoiding things, and all that just makes it worse. Perhaps they have more of an active imagination. And so much of anxiety comes from your imagination, and they start creating things, worst case scenarios in their imagination. But that tends to be the trigger. Once in a while, I'll get someone who has had a trauma. Maybe they've had a parent who had cancer, and the parent was going through chemo and they were doing a lot of throwing up, and then they eventually died. And so they associate throwing up with death. And there's some other, you can have other traumas surrounding vomiting, but typically it's nothing more than an average experience that anyone would have. So yeah.
I have a comment that developed an eating disorder because a reason that if I didn't eat, I wouldn't throw up. Is that common? Hannah alluded to that. And I don't know that it went as far as impacting weight and medical status, but a lot of people don't eat to control the likelihood of throwing up. Ken, do you see a lot of overlap there?
Yeah, but it's not an eating disorder. It's not like anorexia, where anorexics will not eat because they think they're overweight. People with emetophobia won't eat because they think they're going to throw up. So it's
Mm-hmm.
different. So it should not be treated the same way at all. So
Mm-hmm.
you have to know the reason why you're not eating. But
Mm-hmm.
people with emetophobia can become very thin, dangerously thin, and which just makes your physical symptoms worse. So when you're
Absolutely.
hungry, you're going to misinterpret those hunger cues as something's physically wrong with you, so you shouldn't eat, and it's a terrible
Mm.
cycle. Hannah,
Yeah.
did your weight get low?
Um, yeah, it definitely was lower than it is now. I think that's just because I'm a lot more comfortable with eating now than I was before. I couldn't say how low, but it definitely did. But I'm a lot more comfortable now. So
Mhm.
Awesome. Okay, we've been in treatment for over a year, and I don't feel like I'm making much progress. How do you work with clients that may be seen as treatment resistant to usual ERP?
Mhm. Well, I guess it depends on what the resistance is. So
My thoughts
sometimes the
too.
resistance comes from they feel like the therapist was working with them at a higher level. Like even Hannah acknowledged in the beginning, she was just going gung ho into these exposures. And if when I think about an exposure on a scale of 1 to 10, the sweet spot for me and working with clients is about 4, 5, 6, where it's going to cause you moderate anxiety, a moderate amount of distress. If an exposure is too intense, 8, 9, 10, or too little, it's not going to be so effective, and it could scare people. So the other thing is that, you as the client, the patient, are in control of these exposures. We I have to work with you. And so if the therapist is pushing you to do something that you can't do, that could be a turn off. You also have to know how to do the exposures correctly. So Hannah alluded to this earlier. You don't want to white knuckle doing exposures. There's a mindset that you have to have, and there's a correct way to do exposures. Just like anything else. In soccer, there's a correct way of hitting the ball and an incorrect way of hitting the ball, just like anything. So you have to know the correct way to do an exposure. And if you're not learning that, that could also be a problem.
This is embarrassing to admit, but very, very early in my career, I was new to exposures and I was working with a fear of vomit that was presenting as eating issues. And so I'm gung ho. We're doing our exposures, watching the videos, and the whole time she's spitting into a Kleenex, and I just missed the safety behavior. Right. So for her, spitting prevented vomiting. So basically, the exposures we were doing weren't effective because she was practicing her safety behaviors the whole time. It was a rookie move on my part. So certainly seen that too. All right, I want input from both of you guys on this one. Do you feel higher levels of anxiety while doing exposure therapy? The person says, I keep finding myself avoiding it, thinking I don't want to feel extra anxious because I've already got baseline normal anxiety coming up. And this becomes an excuse in addition to things like I'm too busy or when stress goes down. So talk to me about that.
Yeah, well, again, I don't, my preference for people is not to do something where their anxiety level is so high that they're going to be resistant to do it in the first place, or they're going to resistant to it again. You want people to do exposures frequently, daily. Ideally, you want to do them every single day. And if it's too hard, you're not going to want to do it. So as an example, if I'm having someone go from watching photos to videos of people throwing up, start with the easiest ones and then work their way up into harder ones. So some of the harder ones can be really hard. And so, if you need to turn the volume down, turn the volume down, or even turn it off. If you need to stand up and play fun music and dance while you're looking at the videos, go ahead, do that. But eventually you'll have to be able to stop doing the dancing, listening, and you'll have to be able to just watch them. But whatever you need to do the exposures and make it tolerable, I'm okay with that. As long as there's some anxiety there, you have to be able to experience some anxiety, some discomfort, some disgust, and learn how to tolerate it. So you can't make it so easy that you don't experience any of that.
I think of it like lifting weights, right? If you lift something that's so light, like my pen, I'm not building muscle. So some of this is, yeah, to get stronger, it's uncomfortable. And there's a willingness component here, right? Like I'm willing to be anxious, to have my anxiety go up so that it can
Mhm.
come down in the long run. Hannah,
Yeah.
anything you want to add on that? Like how you adjusted your mindset around anxiety or being willing to feel the anxiety?
Yeah, I think Ken's already made a really good point about, yes, it should make you feel a little bit anxious because that's how you become comfortable with it. Um, During the workshop, if we do exposures together, Ken makes us sit there and say, bring on the anxiety, I can do this. We've done all sorts. We've sat and cheered through watching videos of people getting sick. We've done all sorts. And yes, it does make you feel a little bit more anxious at the time, but I think it's also how you then deal with it afterwards. When I first started doing exposures, I would be like, okay, I've done an exposure that was really hard. Now I'm going to sit and relax and I'm just going to chill out. But that kind of meant that I wasn't doing anything. So I kept thinking about it. So now I do an exposure and then I just go on with my day as I would if I hadn't done it. It doesn't give me that time to sit and dwell on it and think over it and over it again. It's not part of the exposure. I've already done the exposure. Nothing in my life has changed. I'm just going to carry on with my day as I normally would. And I think that was one of the biggest changes that helped me get through them.
That's
Excellent
awesome.
point.
I've got a couple questions. So kind of pulling a few together, someone saying they're not afraid of others being sick. So in addition to doing exposures with like photos or videos, how do we tackle the fear of the physical sensation? So nausea and vomiting itself. And then also, how do you mimic the sensations of like fullness or some of those other, those are called interoceptive exposures. So that when we're facing physical signals, but would love to get input from you guys on other kind of exposure targets to hit more of those sensations.
Yeah, like I said in the very beginning, you do not have to make yourself throw up, but you do try to simulate it as best as you can. So I'll have people pretend, and they start off with things like water in the sink, and then move on to the toilet, and then colored liquids. But, again, we break these down into small pieces. And so in the workshop and in the book, we'll guide you through this to help you with that in terms of how to do it correctly and incrementally. But ultimately, working up to the point where you're pretending to puke with disgusting soup into a toilet with barfume. If you don't know about barfume, you can buy it on the internet. It's a vomit spray. It smells
Oh, I
like vomit.
didn't know. I've always just used blue cheese that sat out for a few days. So barfume is great. Keep going.
Right?
Sorry. Keep
Yeah,
going.
so you're pretending to puke with disgusting soup. You can smell it, you're looking at it, you can even play vomit sounds in the background. So what you're trying to do is learn how to tolerate the discomfort. But again, you're doing it incrementally. So when you're at the very beginning stage, don't think about that. Just focus on what you have to do now. Don't think about what's to come 3 months from now. Just focus on what you have to do right now.
And I'll throw in some of the exposures I like to do to hit nausea and stomach sensations directly. Gagging, that'll do it. Chugging something that's fizzy, like a bubbly water, or just even a glass of water and then moving around, you'll get that slush feeling. And then also for fullness, it's just eating a little bit past where you normally stop, especially if you're someone who restricts to avoid those sensations.
Oh yeah, and a lot of people don't like to feel full. So I'll
Mm-hmm.
encourage people, well, eat more, feel
Mm-hmm.
full, and that'll be the exposure. Learning how
Mm-hmm.
to tolerate that discomfort and writing it out because the feeling of fullness will go away within a half hour, at most an hour. So it's learning how to tolerate that.
Absolutely. Got a good question here. When you discuss conquering the fear of vomiting, is it conquering the preoccupation that one could throw up, the buildup of anxiety before throwing up, the anxiety that occurs when a person afraid of vomiting is in the process of vomiting, or all of this, all of it? So what are we actually targeting here?
All of it.
Yes.
Hannah, what do you think? It's all of it, right?
Yeah, all of it. I mean, we talk a lot about how the build up is the worst part and sitting there with the anxiety and with the physical sensations is the hardest part, but we've definitely spoken and touched on everything. And I think that's key to overcoming it completely because you need to be able to deal with all of those situations. And I think Ken targets those really well.
And in the workshop, you talked about how this phobia is different from all the other ones. So if I have a fear of going into an elevator, I'm going to have anticipatory anxiety. I'll have anxiety when I'm in the elevator. But once I leave the elevator, I'm okay. If you're doing a food exposure with emetophobia and you're eating something and you're anxious to eat it, and now you're anxious while you're eating it, you're going to be anxious for the next several hours because you don't know what's going to happen. Is my food going to digest? Will I throw up? So it's just before, during, and after that you're learning how to tolerate that.
Any advice for someone who very quickly goes straight to panic when they feel nauseous? Aside from in big take-home messages, you got to do the exposure work. Ultimately, that's what'll take it down. But any other advice that you guys have for people who go from nauseous to panic very quickly?
Any advice, Hannah? Did you experience that?
Yeah, I definitely did. I think I could feel a slight feeling of hunger and I would go into panic previously. What I think really helped me here is sitting with those feelings and feeling like sitting with the physical sensations and feeling the anxiety. So one of my biggest safety behaviors used to be I would drink a fizzy drink, a carbonated drink, as soon as I felt any sensation in my stomach. I don't know why. I just thought it was going to help. And what I started to do was, okay, I'll sit with this for 5 minutes and then I'll have a drink. I'll sit with this for 10 minutes and then I'll have a drink. And now I don't drink them at all. Like I used to keep a stockpile in my room. The stockpile is still there because I just haven't used them up. So I think just sitting with it in slow increments, almost exposing yourself to the panic slowly, is definitely the best thing that helped me. Just don't expect it to go away instantly. You definitely need to do it slowly, like we said about like dipping your toe in the water. Yeah, that's definitely helped me.
Absolutely. And any advice for not getting discouraged when panic does flare up or anxiety gets the better of you, or you're not kind of perfect or successful with an exposure? How do you stay motivated?
Yeah, I talk a lot about this in the workshop because it is not a linear road to success. It is bumpy. It is up and down. And, I frame this whole problem as a mental game against a tricky opponent. And when you're playing a game, your opponent wins. And your opponent's going to win in this game as well. And you just congratulate your opponent. I'll get you next time. And you learn from the experience. Okay, what did I do that I can do differently next time? What can I change so that when this, because it's going to happen again, whatever you go through. And just remind yourself that it is normal. Setbacks are completely normal. Everyone goes through them.
And
did you have setbacks? Did you have setbacks in the process?
Yeah, definitely. I mean, I think it's to be expected, and it is really hard not to be hard on yourself. And I remember I used to literally like sit and count how many days it had been since my last panic attack and be like, oh, I've got a new record, like I've gone a week now. I think letting go of that really helped, removing the pressure. It is what it is. Things are going to happen. You just have to learn to deal with it. And the more you learn to deal with it, the less they're going to happen. But I think trying to remove that pressure is really important. Don't be counting down the days since your last panic attack.
Yeah, your anxiety monster is already beating you up. Like, you don't have to beat yourself up.
Yeah.
That is fantastic advice, guys. And I think there's some questions in here about hopelessness and, maintaining that hope. And I think this is something that is pretty common with anxiety and particularly with this fear. So I love that you guys are sharing that. And I think for those of you dealing with hopelessness, finding stories like Hannah's and hearing these success stories of, I did this, I was brave, I found the courage, I learned to accept, and look at me now, that helps build hope too. So all right, guys, we got a question about using the workbook. So sort of I'm going to pile some together. I'd love to hear you both talk about a do-it-yourself approach using a workbook, kind of working through doing this workshop series that you guys have both been, like that Ken runs and Hannah's participated in, versus individual therapy. So kind of pros and cons. Do we mix these together? When do you need what?
Right. So there's the Emetophobia manual, there's the workshop, there's other resources out there, and then there's working with a therapist who treats emetophobia. Hannah, maybe you can take this one, because have you tried other therapies in the past, and what seemed to because this clicked for you? So maybe you can talk about it.
Yeah, so I've been in different forms of therapy since I was probably about 8 years old. I'm 21 now, so that's quite a long time. I think what Ken said earlier about finding someone who really understands is the most important thing if you're going to go one-on-one. But I think all of them together, I mean, I don't work with anyone one-on-one now. I work with Ken in a group and I have the book. And I think they both complement each other really well. Working in a group therapy setting means you can hear stories from other people. I think you get a bit of confidence as well from encouraging other people and hearing other people's stories. I definitely think we've bounced off of each other, hearing, oh, well, they've done that, so I can definitely do it. I know we all started in the same position. And I can see us all improving together, which I think is really helpful. But also, I think the book is really useful for when you're in a situation where you can't contact Ken or whoever you're working with. I mean, I obviously have pretty much opposite time zones to most people I end up working with. So it's really important to be able to have something there that I can turn to if I'm not in a group. I mean, we only meet once a week. There's a lot of time to work on things yourself in that time. You get homework throughout the workshop, but also having the book there allows you to work on things that maybe are more personal to you. And you can kind of pick and choose what you think is appropriate for you to work on at that time. So I think there's benefits to all of them out there as long as you can find a way for it to work for you.
Yeah, the book and the workshop really complement each other, because in the workshop, there's a lot of videos of former clients who've overcome emetophobia, and they talk about their experience. That is not in the book. So it's a true complement to the book. But in addition to what we're talking about, individual therapy, super helpful. And then some people need medicine. Some people just need to have an antidepressant on board to help them. And the problem is that when you have emetophobia, you're anxious to try medicine because you're afraid you're going to throw up. But sometimes medicine is crucial to recovery because it'll enable you to do the exposures a little easier. They'll still be challenging. You've still got to do the work, but it just makes things a little easier.
Yeah, I agree. I mean, oh, sorry. I'd wanted to try medication for years, and as Ken said, I was too scared. I was scared that it was going to make me throw up. But probably only about 2 or 3 weeks into working with Ken, I decided that I was going to try it. And I think a combination of that and working with Ken is what's changed my life so dramatically. I was so glad I was able to do it, but I definitely don't think I could have done it without working with Ken as well. I think the medication just kind of took my baseline anxiety down a bit lower, so I was able to better participate in exposures and things. Again, I thought I was someone who could never take the medication because I was way too scared, and I did end up doing it. So, yeah, it was very helpful.
And did you throw up from the medicine?
It's so brave, Hannah, and we've got comments coming in and talking about how you inspire them. So thank you for sharing your stories. Quick question, can you overcome the phobia without knowing how it originated?
Yes. Oh, yeah. Yeah,
Absolutely.
this is not a psychodynamic approach.
Mm-hmm.
Unless someone wants to talk about early vomiting experiences, we don't really touch on that much. However, if someone has a vomiting experience or experiences or other people throwing up that is still impacting them today, so they have bad memories that they maybe intrusive recollections of what happened, then that will have to be dealt with. And then there's something in the book about that. EMDR is really helpful for those kinds of things. So if you do have some sort of memory, whether it's traumatic or not, it's traumatic to you, then that'll have to be dealt with. But a lot of people, nothing from the past is particularly upsetting in the present, but they do have memories, of course. They have a lot of memories. Mm-hmm. So if it's overwhelming, then that'll have to be dealt with.
Mm-hmm. They've got several questions of people asking about the difference between safety behaviors and quote unquote normal behaviors that anyone would do around getting sick. So can you guys talk about how do we find that line between this is quote unquote normal versus this is a safety behavior?
Right. And particularly since the pandemic and everyone, for at least a year or so, sanitizing and washing their hands and all that. And now people are sort of loosening that. Sometimes the line is kind of blurry. And is this a safety behavior or is this a normal normal behavior. And it's hard to know sometimes. And sometimes you have to turn to people who don't have emetophobia and look and observe, like, well, how would a non-emetophobe act in this situation? Because if you want to be a non-emetophobe, you have to act like one. So, if your spouse doesn't have emetophobia, okay, what would they do? Do they have to cut into their chicken and look at the inside with every bite? Do they need to wash their hands constantly like I'm doing? So think about that. Just be really observant of people with emetophobia and try to mimic that.
Mm-hmm. And anything you want to add when you were figuring out how to cut out safety behaviors? And then also, I mean, you're in medicine, so you do have to take some precautions with things. So how do you decide this is a safety behavior that's feeding my fear and this is a normal, necessary precaution?
Yeah, I think obviously Ken's already spoken about discussing with other people. We also discussed within the group of a group of 8 people with emetophobia which safety behaviors we did, and you'll find that we had so many different ones. Like, I've never heard of anyone having a safety behavior of drinking a fizzy drink like I did. But also, there are people that you'll hear from who wash their hands with boiling hot water, which I've never done. So there's so many different things out there. I think what I would suggest is before you do a safety behavior, think, am I doing this to alleviate anxiety? Then yes, it is. I think also, like, it can take you possibly to do things that even non-emetophobes wouldn't do or would do. Like, if it's challenging your anxiety, just go ahead and do it. Like, that's probably one of the best things I've done. But yeah, stopping and thinking before you do anything, thinking about really, why am I doing this? Yeah, I would say that's probably been helpful as well.
It's helpful in the workshop too, because you observe people, like Hannah said, have different safety behaviors and different things they avoid. And whereas some people with emetophobia will avoid eating beef, other people won't. And it's like, okay, well, they're emetophobic, but they're eating beef. Well, maybe I can eat beef because they're not afraid of eating beef. So it's very, I avoided doing group therapy for emetophobia for a long time because everyone presented so differently. It's turning out to be quite helpful because you get to see other people experience their emetophobia quite differently. And that in it itself, I think is beneficial.
Mm-hmm. Got a lot of questions about how to deal with the anxious preoccupation, like the thoughts, thinking about throwing up, thinking about kids bringing bugs home, in that the aftermath of, like, if a kid or someone does get sick and you're sort of in this anticipation period, am I going to get sick too? What advice do you guys have for dealing with those thoughts?
Yeah, the thoughts can be continuous. Hannah, did you have thoughts all day long while you were having all those symptoms?
I did before, not anymore.
Yeah.
Yeah, definitely did.
Yeah, and it takes a while. It's not something that's like a light switch that's going to go off. It's just doing all of the different things that we talked about in the workshop, putting it all together, slowly noticing that the thoughts begin to subside. But, I use the metaphor of, you're driving a bus and you got this anxiety monster, your opponent in the back, and he's trying to engage you. That's one of his strategic moves, is to engage you. And so he'll do it in lots of different ways, by asking questions, making threats. And your task is not to engage with the opponent.
Mm-hmm.
Because the more you do, the more anxious you're going to feel. And really, once you're in it, once you're engaging, it's really hard to stop. So we talk about how as soon as you begin to experience the thought, and as soon as you begin to recognize that you're having the thought, is to quickly turn away from it. And in the workshop, we talk about some very specific things you can do, but it's really that quickness. It might be similar to someone who you're walking down the street and maybe there's a homeless person that you perceive as maybe kind of dangerous and they say something to you, you would just continue on. You wouldn't engage, you would just keep going.
Mm-hmm. We've got so many questions and not enough time to hit them all. So trying to see if there are some that would hit themes. What about some quick ideas for exposures when it comes to the social component, like throwing up in front of others or that sort of being judged piece?
Mm-hmm. Yeah, so in the book, we talk about this in the workshop too, you can write your emetophobia horror story. And there's guidelines that we talk about, and you would basically write out the story and then read it out loud. And you're trying to make this story horrible. Like you want it to elicit anxiety while you write it and read it. So, and then you end up reading it over and over and over and over again. So that's one thing that you could do. But a lot of times people with social anxiety and emetophobia, those two disorders together will make it very challenging. And so you might have to do things like, once you're pretty good at pretending to puke in your home, you then start pretending to puke outside of your home, like in a private bathroom in a Starbucks. Because so much of what you're fearful of is, okay, what if I throw up in front of other people? And so you have to get this idea that, okay, if I have to throw up, I can throw up in a public restroom. So you would practice, but that is really hard, particularly if you have social anxiety, to pretend to throw up in a restroom, even if it's a private one.
Great. Want to hear, how do we find the right therapist and advice on, well, I guess that, and with that, thoughts on EMDR as a treatment. How long should it take till you start seeing some progress? And how do people get involved in your workshop? Are you doing another one?
So EMDR, great for trauma. You can go to ADAA.org and find a therapist who specializes in anxiety. International OCD Foundation also has a search engine for therapists who treat OCD. So those are the two organizations that I would go to. The workshop, I would advise people to, in addition to reading the book, to go to the workshop, go through it. There's 10 or there's 11 actually groups, 11 classes, go through all of them. And then if people are interested in getting additional help, they can always join a live group or seek out help with me privately, but or even have a consultation, just one-on-one consultation. So yeah.
Fantastic. And okay. Can you touch really quick on the different, well, there's a question on ARFID versus emetophobia. I think Ken answered that earlier of what's driving the fear. If it's a fear of vomit, it's emetophobia. ARFID is avoidant restrictive food intake disorder. So, all right, hitting just a couple more. Hannah, when was the last time you were sick is a question. And then would love to touch a little bit on relapse prevention.
So the last time I was sick was a couple years ago. But the last time I was sick from actually being ill, I was 12, so about 9 years ago. I haven't, I was lucky to never be sick while my emetophobia was at its worst. But I still think I could deal with it better now than I did a couple years ago.
That's wonderful. And then we've got several questions on, can you become phobic again after being cured? If you do end up getting sick once, are you cured, or is it going to make it worse? And I'm going to lump all of this together and have you guys just mention, how do you move forward and keep this fear from taking root again?
Yeah, just because you throw up doesn't mean you're cured. It's just like someone has a fear of planes, just because they go on one plane ride doesn't mean they're cured. So don't think if you just throw up once, you'll be fine. Relapse is possible, so you do have to continue to monitor that and make sure that you're not doing safety behaviors. So once you get to the point where you're living life and you're doing well, make sure that you're not avoiding anything, not doing safety behaviors, even periodically looking at videos, periodically pretending to puke. Just make sure that you're doing everything you can so you don't relapse.
Awesome. Thank you guys, both Ken and Hannah. Thank you for all of the insights and experiences that you have shared. Thank you to everybody who's participating live. You guys have so many questions. To be honest, I'm so sorry if we didn't get to yours. There are just too many for us to get through. So clearly this is common and people are thirsting for knowledge and insight. So thank you.
And in the workshop, there's people in the workshop that are asking me recorded questions all the time, and I answer those questions. So if you have a question, possibly it's answered in the workshop.
Awesome.
Well,
Thanks.
thank
Thank
you,
you. I want to
everyone.
thank Hannah very
I see
much.
lots
I
of
really want to
applause.
thank Hannah very much. I really appreciate her being with us. She was a brave volunteer for coming forward, so I appreciate that a lot.
Thank you.
Well, I see lots of applause coming up. So great job, everyone. Thank you so much. You guys were great. This was a wonderful presentation. At this point, we are going to wrap up today's session. And so thank you, Ken Goodman. Thank you, Dr. Ashley Smith. And thank you, Hannah, for joining us. Just a little bit about ADAA, the Anxiety and Depression Association of America, works to prevent, treat, and cure anxiety disorders and depression through the alignment of science, treatment, and education. We invite you to explore our website at adaa.org, where you can find resources as upcoming webinars, blog posts, self-help books and publications, and also consider subscribing to our free monthly e-newsletter, Triumph. So thank you again for joining us. We hope to see you next time.
Thank you all.
Thank you.
Bye.